Let's go back in time to 1971. I remember it. I was a student at the University of California. It was crazy times. And that's when President Nixon declared the war on drugs, which halted the research of psychedelics. But now, 50 years later, the medical science cannot be denied, and we're witnessing a therapeutic psychedelic drug renaissance. Our investigative producer, Leslie Marcus, kicks off today's psychedelic drug episode with a report on a groundbreaking mental health treatment. Take a look.
Right here in the center of New York City, psychedelic drug therapy is getting a major makeover. Come with me as we check out the new age ketamine clinic called Field Trip Health. I caught up with Lauren, a wellness entrepreneur and host of the new YouTube show, Biohack Her. What made you want to try ketamine?
I weirdly had a seizure a year after having my kids. I had a very traumatic delivery of my twins, and I carried that trauma on with me where I would always have crazy thoughts of my kids dying or people doing really awful things to them, and I would take it to the next level and stress myself out as if it was happening.
You didn't know that you had a PTSD diagnosis until you came here?
Yeah, so what you do is you sit down with a psychotherapist before to make sure that ketamine is the right treatment for you. It's not like you can just come in off the streets and do a ketamine session.
You're about to get your first ketamine treatment.
I'm excited. Nervous, but really more excited to, work on these things that I think have been affecting me, especially in the last 2 years. But there's also things that I want to work on just as a person, I want to be more playful. I want to be more light.
Next, I met up with Matt, the vice president of the clinic's healthcare practice. We're in one of the mini treatment rooms right now.
We have a zero gravity chair here. The therapist is right here during the full session. Roughly half of that session is the ketamine treatment itself. So the individual receiving the treatment essentially journeys inward during that period. There's not that much communication. And then when they come out, the therapist is right there to unpack that material and use that in the therapy session.
So Lauren, you just finished your treatment. It took about an hour. What was it like?
I initially experienced death, which was very hard for me. All I could do was focus on my breath. And then you kind of go off into the abyss. And then I was confused on whether or not I was having another seizure. And then I also relived the trauma of exactly what it felt like right after I had my twins.
Physically, what was it like?
I couldn't stop shaking. And then all of a sudden, I just knew to just say, you don't need to shake anymore. It was just this calm feeling. And afterwards, which has been a couple hours now, I feel very connected to myself. And I'm still unsure of what this means for me for the future of how I see my trauma and whether or not I'm still going to, react in the same way that I was before.